Hi everyone, my name is Pete. I'm a no ALL ambassador. I was diagnosed with ALL in 2013 at the age of 18. And I'm here to speak a little bit about what questions to ask your doctor, basically. So following the diagnosis, you're going to have a lot of questions, a lot of things on your mind. And it's really good to ask your doctor questions. It's really good to get answers to those things. But also, don't worry too much and do bear in mind that there will be other opportunities for you to speak to professionals, to ask a doctor. So if there's something you forget or you're finding everything very overwhelming, don't worry too much. So I'll be speaking from my perspective as a patient. Obviously, everybody is different, and you may be different. So this is very personalized to me, but also from my experience, these are what I think, what advice I would give to another patient or another caregiver of a patient. One of my top tips that I would say to everybody is before you start asking questions, have a notebook and pen with you or something to take notes on, because following a diagnosis during that time when when you first have symptoms to being diagnosed, the first couple of weeks of treatment, that is a bit of a whirlwind and you are given a lot of information, and that is hard to take on, and you probably won't retain all of it. So bring a notebook. Any big words you don't understand, anything you do understand but you might forget, just make a little note of. This is also a really good way to, when you know you're meeting with a doctor following your diagnosis, this is a good way to kind of compile the questions that you want to ask, because when you're in that meeting, it could be scary, daunting, and you could forget some of the things that you wanted to ask, and you don't want to leave thinking, oh, I wish I asked that. Um, so yeah, you write down questions that you might want to ask. It may also be helpful to take a loved one, a partner, a parent, whoever with you, for a couple of reasons. One, because they may have their own questions that you don't think of. Another thing, because as I said, it's very difficult to take everything on, and having another person there would be good when you're reflecting, when you're trying to remember what was said, or they may have a different understanding of things than you had, which can be really important. And it is also really important to remember, your whole support group in relation to your treatment and your journey. Um, I would say ask whatever you want. Don't worry if it sounds silly, if it sounds irrelevant. Obviously, being diagnosed with ALL is a massive thing. And a lot of things can seem irrelevant at the time, but if there's something which is important to you, then that is absolutely important, and you have the right and you should ask those questions. And remember, these are like very skilled medical professionals and will give you the best answer. So it is really good to ask that to them. This could be stuff from, I saw this really silly thing online that I'm not sure if this is true because there's so much information online, and they could help to clear those things up. Or it could be about, I don't know, childcare. It could be about, how does this impact whatever's going on in my life? But if it's important to you and if it's worrying you, do ask and try to make sure that you leave with all your questions satisfied. Even if that's not a direct answer, that might be, oh, you can find out here, or I'll refer you to this person. You will feel better if there's little things which are annoying you, and you're worried or unsure about, and they get answered. So when I was diagnosed, my first questions were prognosis. I said, you know, how treatable is this? How far is this along? That kind of thing. I think that's going to be the same for a lot of people. Um, so having said that was my first question. When you're making these notes of which questions you might like to ask, obviously ask whatever you feel is relevant, but is what might be helpful to group them together, as I did with the first question about my prognosis, into questions about your diagnosis, questions about treatment, and questions about life outside of this as well. So consider those things when you're thinking about what you might ask your doctor. The other thing I asked was how far along is it? Which I think many people ask, because that's kind of one of these things we associate with cancer. I was told that for my personal situation, that was kind of a bit irrelevant because most people with my diagnosis would be exhibit symptoms at the same time. So nearly everybody gets diagnosed at the same point, but that might be something that would be different for you. So if there's a question that you want to ask, definitely ask your doctor. Um, Something I think would be really helpful to ask is the specifics of your diagnosis. Because obviously online, there's very many reputable sources of information about ALL. But if there's anything that makes your diagnosis different or unique, it's helpful to know that so that you can filter through and see what of that information is relevant to you and what isn't. So things such as your subtype or anything else which may make your diagnosis a bit more unique or different to the general ALL diagnosis. Another thing concerning your diagnosis you might want to know is the symptoms that you've been having and how that relates to your diagnosis. So, for example, a lot of them are caused by things going on with your blood, so anemia and that kind of thing. And that's helpful to know. That was helpful to know for me because I was like, oh, many of these are caused by anemia. As soon as my red blood cell count comes up, I'm going to feel better. That symptom's going to be gone. And then there's other symptoms which are, caused by different things, maybe longer term. And it can be helpful for you to understand that because chances are when you're diagnosed, you're feeling quite unwell. And it'd be good to know when is this going to change? How is this going to change? Another really big thing that I would maintain throughout all of these questions that you ask is ask for literature and resources related to these questions. So, say for example, just about your diagnosis, about ALL in general, is there a leaflet, a booklet, a website, something like that that you can then, as I said, it's so much information. If you have something like that, you can then go away, look at it in your own time when you have friends and family visit and they're asking questions and you don't know the answer, you can look back in the booklet or whatever resource it is. And if you get this from your doctor, it's likely much more reliable than many of the sources online. Because there's a lot of misinformation online. Obviously, there is great reputable resources, but it can be hard to filter them out sometimes. So getting it from a doctor saying, "Oh yeah, check out this website" or take a look at this booklet, and I found that really helpful. And I've had probably a pile this high of booklets and leaflets from everything from fertility, treatment, diagnosis, mental health, things like that. And it's better to have more than you need and not use it than have questions left unanswered or, things you're Googling at 2 a.m. because now it's worrying you and you're looking on different social medias and stuff and getting all this misinformation. So this would be likely be much more likely and to be accurate and relevant than that. The other thing I like to think about treatment, this is obviously going to depend where you're treated and to do with your diagnosis as well. But is a good idea to ask about treatment options, clinical trials, and research trials, just to know what is available to you and what your treatment options look like. And in terms of this as well, it'd be good to ask about itinerary, what treatment is included in this, and what does that mean for me? And also about length. That was one thing that really I wish I asked was how long is this going to take to treat? Which was kind of jumped on me quite far in. So it is good to know, how long will I be in hospital for this? What does this treatment mean for me? But again, this is something which you can ask a little bit later date if this is a lot of information to take on at one time. But I will say, as early as possible, discuss fertility and fertility preservation, unless, of course, you are absolutely certain that this isn't going to be something that affects you. I think that even you need to think, is this going to be something which might affect me in 10, 20, 30 years time, as it was for me, and really speak about that soon, speak about how your fertility may be impacted, and how options for preserving that. Unless, of course, this is completely irrelevant to you, in which case that I know is something you don't need to ask. In terms of treatment, obviously fertility is can be a side effect, but also discuss other key side effects. Because there's obviously you see cancer represented on TV and stuff all the time. It's not always accurate, and also it's not always generalized. So, what can I expect going into this treatment? How am I going to be feeling? Am I going to be able to work at any point? Um, those kind of things are really quite helpful to ask. Outside of that, life in hospital is a good thing to ask about. As I said, like when discussing your treatment options and your treatment itinerary, how long am I going to be in hospital for? Do I need to get somebody to bring a laptop in? That was one thing that I was told quite early on was you're going to be bored for 5 weeks straight. So make sure you have as many books, laptops, internet, whatever as possible because um yeah, there's going to be a lot of sitting around for you. So yeah, consider your life kind of aside from the whole treatment in terms of I guess holistic needs and what can help you through that time and ask questions pertaining to that. Another thing would be really helpful to know is your key contacts in the hospital. Um, obviously the first doctor you may speak to following your diagnosis, that may be one of the big consultants that you don't see as often through your treatment. It'd be good to know who will I be seeing, who will I be interacting with, and what is it that they do. And add into that, where do I go if I have more questions? Because you will have more questions, which is great, and it's good to know where do I direct these to. And then again, I guess thinking outside of the hospital, outside of your treatment, is thinking about the you and the people around you in general. So I think it'd be really helpful to know or to ask what help and support is there for me and my loved ones going through this, because that's one of those things you're not going to know necessarily going into it. And also one of those things which will vary a lot depending on which country you're in, which part of the country you're in, and your own circumstances. So that's my list of things that I think are really helpful to ask when you've just been diagnosed. However, do think about this, discuss it with your family, with your loved ones. As I said, my top tip would be notebook and pen or notes app on your phone. Make a list. And you're well within your rights to have your questions answered, and make sure that you do get them answered because they will definitely make you feel better once you've spoken to a doctor about it and you get a reliable answer to those questions.